All right, we are back for part 2 of our January professional development training to talk about parent-child interaction therapy. So, PCIT integrates components of social learning theory, attachment theory, and just all the theories that we dove into in 2025. So, for social learning, they're using differential attention to address behavioral problems. For attachment theory, they're focusing on helping the parents facilitate warm and supportive relationships. Behaviorally, they're using an authoritative parenting practice to kind of get that balance between nurture and boundaries. The goal is to improve the parent-child relationship by helping caregivers adopt an authoritative parenting style that meets the child's needs. So there are two phases and stages in PCIT. There is a child-directed interaction phase and a parent-directed interaction phase. The child-directed interaction phase comes first. And this whole process is taking anywhere between 12 to 16 weeks, right? So initially in the child-directed interaction phase, the parents are taught by a professional how to interact with said child. So the focus is not on modulating the child's behavior. The focus is not on changing the child in any way. The focus is on educating and informing the parent on how to create a better rapport, how to engage with the child as they are, and how to interact with them and follow their lead. They're using this through this acronym of PRIDE. So praise, reflection, imitation, description, and enjoyment. And so these are the skills that they're looking to develop and model with the parent, and then for the parent then to do on them own and to execute independently with their children. So let's dive into that. So with regards to praise, we're looking for label praise versus unlabeled praise. So unlabeled praise is what we as nannies often give. So this is your fantastic, terrific, great job, good job. We love that. Oh, awesome. Like this is very non-specific praise. We really want to find ourselves closer to labeled praises because this praises the exact behavior that the child exhibits. So thank you for picking up your blocks. Thank you for sharing your toys. Great manners. When you're using specifics, when you're praising, it increases the likelihood that the behavior will continue in the future. It increases that child's self-esteem and it makes you both feel good. On a bonus tip, label praises should not be limited to children. Adults who know how to effectively give specific praise are often regarded as better bosses, better significant others, friends, and or family members. Next, we have reflections. This is simply repeating back positive statements made by the child. The caveat to this is if your child is saying something negative, something damaging, cursing, things like that, we're not going to reflect that back. But we do want to reflect back what they're saying. This is a way to engage with children who are on the autism spectrum disorder um, who have been diagnosed with autism spectrum disorder. And so you can do this in a couple ways. You can do it specifically at like a direct repeat. You can elaborate or you can paraphrase. So my friend's name is Charlie. Your friend's name is Charlie. I like pizza. You do like pizza with cheese and pepperoni. I'm going to be Mirabelle for Halloween. Ah, yeah, Mirabelle for Halloween. These types of things help to show the child that you're actively listening. It helps the child know that they are important and it helps them to increase what it's like to communicate, responsibly to one another, which increases language skills. Reflections are not just important in the caregiver and child or the nanny child or the parent-child relationship. It's important in life. Being able to use reflective communication is a sign that you are an active listener, right? So when your clients are coming to you and they're saying, "Hey, Erica, we'd really like you to, help so and so work on potty training. That's really a goal for ours that we'd like to accomplish before the end of February, along with, them trying to diversify their palate. Okay, gotcha. So we're focusing in on potty training. We want to increase, the options that they're eating for lunch and for snack, and then walk through that. You want to reflect back what they're saying to establish the baseline of understanding. Next, we have imitation. This is quite simply just doing what the child does. It's playing with the same toys as the child is doing for the purpose of establishing rapport and connection. So if a child is pushing toys on the floor, then you push toys on the floor. If the child is reading a book, then you sit beside them and you read a book. The caveat to this is that you are just imitating what they're doing. And what I see when a lot of us get involved in play sometimes is often we get into it and then we try to expand it, make it bigger, and low-key kind of take over. So Johnny's down there, he's pushing the floor, or Johnny's down there, he's building with Legos. Oh, we're building. Oh, I see we're building. What are we building? And he's just, I'm building a house. Oh, let's build a castle. What about building a castle? What if we do a neighborhood? That's not what he said he was doing. He said he was building a house. And for the purposes of imitation, We're not coming in to force interactiveness. Most children who are been diagnosed with ASD tend to play parallel, right? So we're not trying to force this interactiveness with it. We want to let them know that we are content to just be with you. We're content to play alongside you. It let them lead the play. It helps us to get down at their developmental level, and it makes that more fun and not a sensory overload for the child. Next, we have behavior description. So this is narrating what they're doing. So Johnny's down there building with the house. What are you doing? You're building with the house. Oh, you are building with the house. Wow, you're making it really, really tall. It has a lot of colors. I see you just put the green Lego on the top. That's super cool, right? So you're describing what they're doing. You're building a fence to keep the animals safe. I see you're pushing your car up the ramp. This again helps the child be in the lead of the play, then lead out. But it also lets them know that you're paying attention to them. This is actually specifically beneficial for children with ADHD. So I don't know if you've ever been doing something and someone calls attention to what you're doing, right? So you're typing, and someone comes up to you and they say, "Oh my God, I didn't know you type so fast. You type really, really fast." And then they just walk on. Right? And when you type after that, you will find yourself noticing how fast you are typing. The same is true of our children. When we make these behavior descriptions in real time as we're narrating, what it does is it boom brings them back in. This is extremely beneficial for children with ADHD. So if you find that they're wandering or sorry, they're building something and they're starting to get onto something else. Oh, I see that you were building that house over there. Wow, you did a really good job. What are you doing next? What are you about to add to it next? Are you done with it? Are you adding to it? What are you doing? And it what it does is it refocuses them on the task at hand and helps them to have a longer attention span for that particular activity. And lastly, we have enjoyment or enthusiasm. This is being animated and cheerful while you're interacting with the child through play. This is extremely important for children with ASD because often they are reading our faces and our tone and not listening to our words per se. And so, entering into their space with enjoyment, with enthusiasm, smiling, looking happy, being loving and nurturing is really, really important. Children are less likely to play with adults who do not appear to be happy spending time with them. As a matter of fact, just in the scope of our business, there are so many nannies who have been released from jobs simply because parents, in watching them over weeks and months over nanny cams, are like, they never look happy to be here. They never look like they're having fun. My child is super excited to see them. They don't look happy to see my child, and that matters. On the other hand, for those who have really, really big personalities and who kind of come into the room like a bull in a china shop, we want to be mindful of making sure that we're not so overly enthusiastic that it becomes adverse to the child, right? So for children for whom maybe they're a little bit more auditorially triggered, we want to be enthusiastic without being super loud, right? For children who may have like some sensory processing and maybe are touch averse, we want to be enthusiastic while keeping our distance, right? We want to make sure we're modulating that for the child, but we still want to be excited. We want to show enjoyment. When we walk into a room, my goal is that the child knows, like, I am so happy to see you. When I pick them up from school, I missed you today. I've been waiting to see you. I am so excited to see you. I missed you so much. Couldn't wait to be with you again. I've been waiting until 3:05 so that we could be back together. I missed you. All of these things really matter. It enhances the child's self-esteem. It makes the play more entertaining and more memorable for the child. So those are the things that are happening in the child-directed interaction phase. The parents are being coached on those types of things. And these are things that have a broad reach, right? They are both extremely beneficial for our children who have been diagnosed with ASD, but they are also extremely beneficial to children everywhere. Then from there, they move into parent-directed interaction phase. And so this is where that professional is coaching the parent on their interactions with their child, specifically to implement additional behavior management strategies to help them reduce aggression and destruction and frustration and things like that, and how to navigate when it's not just happy, happy playtime, right? And so that can look like a two-way mirror where the coach is talking to the parent and instructing them to do this, don't do that, move here, speak like this, say that, or they're in that space with them in their home and they're coaching them on how to interact. The guidelines for effective commands are as follows. They need to be direct, positively stated, one at a time, specific, developmentally appropriate, stated in a normal tone of voice, with an explanation or reason, and only when necessary. So a direct command, one of the things that a therapist told me very early on in my career when I was working with children with autism is oftentimes they're going to pay attention to the tone in which you say something more than they're going to pay attention to what you say, right? And so I found that for my children, in that stage of my life, I used to talk in a question. So let's get ready to go to the door. Let's get ready to get something to drink. Like everything seemed to like go up. Let's get ready to get something to drink. Are you sleepy? Are you hungry? Let's get ready to go. Let's get in the car, right? All of those things, both questions and statements, sounded exactly the same. And working with that person helped me to really change the way I spoke so that even if they weren't dialing in on my words, my tone indicated to them that something was happening and that it was more likely a command. A direct command makes it clear what the child is being told to do. An indirect command suggests or implies or asks. So if you're giving an indirect command, it would be, can you put your plate in the dishwasher? Can they? Yes, but are you asking them to? No. I want you to put your shoes on. You're suggesting that just because you want it to happen doesn't mean it needs to happen. Let's pick up the blocks. I see this a lot. When we say let, it implies that we will be doing it with them or that this is a joint venture. If you're not planning to do it with them, then you don't need to say let's, right? Instead, you want to say it's time to clean up. Please put your plate in the dishwasher, right? It's time to leave for school. Please put your shoes on. It's time for bed. Please pick up the blocks, right? These are ways that we can give things in a way that children can really understand, and that they could grasp quickly to what is being asked of them. Next, we want to make sure that it's positively stated. We want to say it in a way that we're telling them what to do and not spending all of our time telling them what not to do. So specifically with children who are on the autism spectrum disorder, they can't spend a lot of time with you narrating what they shouldn't be doing. If they're going to be ingesting all of your verbal language, they need to do so with them knowing what they should be doing, right? So instead of saying stop yelling, quit jumping, don't run, say use your inside voice, sit next to me in the chair, please walk next to me, right? And saying please is a really great way to ensure that there's a mutuality in the level of respect. Please does not necessarily mean that it's a question. It just implies respect and kindness. Next, we want to give those commands one at a time. Make sure that the commands are given not in a multi-part segment, but specific to the tasks that need to be done. As we watched in that direct trial, the discrete trial, they're given one specific thing to do, and then they can grow to larger commands. But when you start, you really want to do this one at a time. Put your shoes on, put on your coat, wait for me at the door versus let's put our shoes on and grab our coat and go to the car. That's a three-part command, and that could be a little bit disarming for someone who has that diagnosis. Next, we want to be very specific. Sit quietly in our chair, keep your hands to yourself. We do things like this, stop that, behave, settle down, act your age, chill out. All of those are very vague commands. They don't tell the child what specifically they need to do to achieve that. So sit quietly in the chair, keep your hands to yourself, keep your toys on the table. I hope that you are realizing that there are so many ways, as we talked about from the pathology lens and the neurodivergent lens, that we should be modulating the way and changing the way that we are presenting stuff, the way that we are setting up the environment, the way that we are giving commands to give our children a better chance at success in our presence. Next, we want the task to be developmentally appropriate. So the command that you're given needs to be age appropriate. If you are giving a command that is outside of their ability to obey or to understand, it is unfair, right? So hand me the blue block versus hand me the aqua cylinder. Give me the triangle versus give me the pyramid. Even down to if you have a child who doesn't know colors or shapes yet, can you hand me that block, right? Hand me this block right here and you touching it. Versus saying hand me the blue block if you know that that child doesn't particularly know their colors yet. We want to make sure that we're giving them tasks that are within the wheelhouse of what they can do if it's going to be a command, right? Next, we want to make sure that we're saying in a neutral, calm tone of voice. Again, it is always helpful to say please, to be more pleasant, and to reciprocate that respect. And then we want to give a reason for so many of our children, a why is following, right? You ask them to do something, their next question is going to be a why. We can just go ahead and meet that need by giving the why with our command. So it's time for bed, please pick up the toys. It's cold outside, please put on your coat. I need to fill up your drink with water for school, please hand me your cup, right? When we become consistent and predictable in the ways that we give commands, we reduce these power struggles with our children and we help them to respond more appropriately over a consistent amount of time. And then we only want to give commands when they're necessary. None of us like to be micromanaged. We hate when parents are just like riding over top of us, telling stuff that we already know to do, or just asking us to do stuff that is completely unnecessary. And the same is true for our children. They want to be given commands only when they are necessary. Um, yeah, period. So if it's necessary for safety, if it's necessary for time management, if it's necessary to move on to the next activity for health, whatever that may be. But we want to minimize what we're saying. We don't want to just talk for the sake of talking and to hear the sound of our voice, especially when giving commands. If you're going to talk, dialogue, narrate, do things like that. But when giving commands, make sure that what you're giving is necessary because should the child not obey or have trouble with it, you're going to need to back to it. And if it was not necessary, the likelihood that you're going to be able to positively reinforce that behavior is really slim because you're probably just going to fall off and be like, never mind, I didn't need it anyway, which increases the likelihood because now you have positively reinforced them not obeying you, which increases the likelihood that that will be your outcome again in the future. So only when necessary. So again, when we look at PCIT, PCIT is one of the most researched, um, scientifically successful parent training programs for children around the world. And so it has a high degree of success. It helps to um, just bring the family together in a more cohesive way. And I don't know about you, but there's been so many times in my career where I've done something and been able to achieve something with the children, but that doesn't necessarily transfer to the parent, right? They still struggle to get them to do those same things that I don't struggle to get them to do. And what PCIT does is really just it inserts themselves in there in a way that teaches the parent how to get the same result, right? So ultimately the goals and the gains stay within the family. So a couple of things we want to just roll back on. Positive reinforcement is more than a vague good job after behavior. It requires an antecedent, then there's the behavior, and then there should be a reinforcer. Focusing on how we present commands can drastically change the outcome in our children. And we want to really commit to a strength-based approach. So when we reflect back on what we learned with ABA, and all the different techniques that are utilized there, as well as PCIT from the child-directed portion to the parent-directed portion, we've been given a lot of information on ways that we can change our presentation of information to our children to achieve different outcomes and how we can better serve those who are in the autism community to provide them the empathy, the compassion, but the intentional care that they deserve. So when you think about this, I want you to make a daily affirmation or an application for yourself. I will commit to whatever that is. I will commit to positively reinforcing behaviors that I want to increase. I will commit to reducing the time between the positive reinforcement and the behavior that just occurred. I will reinforce immediately. I will commit to um, giving very specific praise versus unlabeled praise. I will commit to giving very specific commands versus indirect commands versus indirect commands. Whatever that commitment is, pick one and then find yourself focusing on that and implementing that this week. I am 1000% sure that regardless of whether you're in a home where you're blessed to deal with a neurodivergent child or you're in a home where you're dealing with someone who could be deemed as neurotypical, you will find benefit in this information and these approaches. Next up, we had a speaker, Lori Frederick. We will put her presentation in here for you and we'll link it to our Slack and to our other channels so that you can listen to what she had to say. And that is all we have for today. We really thank you for your time, your energy, and your attention. Our next training will be on March 10th. That's Tuesday, March 10th from 6:30 to 8:30. Please mark your calendars and we look forward to seeing you at that time. Take care.